So we had to use drone because we had various forest areas, and the drone was very helpful. People without even seeing police personnel, on feeling the presence of drone, they would just run back to their state. So it was also very helpful. And in addition to enforcing lockdown, we also actively participated in IEC program, Information, Education, and Communication program. All officers were also on the ground and ensured that people were maintaining social distance, even if they are going out. And we, while ensuring lockdown completely, we also did not forget the importance of maintaining supply lines. And we ensured that there was free movement of essential commodities, trucks carrying all the essential commodities. And another important thing that we did was many migrant laborers were stuck up here. So it was our priority to help them. So during lockdown 1 to 3, even a movement of migrant laborers were not allowed. So we had to keep our vehicles ready, buses are ready at borders also, so that we can pick them up and drop them back to shelters managed by our administration. And some of the migrant workers were even dropped back to their caretakers. We also had, after lockdown 3, I think this moment of migrant workers were allowed, interstate movement of migrant workers helped in escorting 21,000 migrant laborers from capital to Assam side, other various districts of Assam, and even to Jammu and Kashmir. About 150 migrant laborers stuck up in Arunachal Pradesh. They were, some of them were small businessmen selling some cloth item here. So they were also escorted back to Jammu and Kashmir. From there, they are still calling us, thanking us from Jammu and Kashmir. And there was one problem during the initial stage when 70 migrant workers had crossed over to Assam. So Assam police did not allow them to come to Assam, so they were pushed back. So in the night itself, we went there and in the border, and then took good care of them. We provided them food and houses to stay in the night, and in the morning, we again brought them back to capital and provided them shelter and food here. And because of our enormous hard work, the infection rate in capital complex is very less. As you may be knowing that Itanagar capital region house about 30% of the state population. That means out of say 15 lakhs, we are having around 5 lakh population in capital complex. But the infection rate, which I think should be very high here in capital, is much less because of the hard work put in by capital police. And during the entire period, we never use this forces. We never use lathi charge or anything, any kind of harassment to the public. We also ensure that our people get medical assistance as and when required. For that, we started a COVID control room by the capital police, where and also circulated the numbers to various corners, and also pasted our numbers, 24/7 helpline numbers. We kept vehicles, police vehicles at various locations, so that we can help pregnant ladies, all people who were without anybody to take care, so that we can take them to hospital in case of necessity, in case of emergency, and also provide them essential commodities in case of requirement. And because of our proactiveness and because of our friendly policing, many people came forward to help us. And it was a record that we in Itanagar Capital Police received around 37 lakhs of rupees in cash from various NGOs and influential people, better well-to-do people to help the poor. And that was in case. And in kind also, we received many items like sanitizers, mask, gloves, PPEs from various parties. So we are very thankful to them. Also guarded around 30 quarantine centers, so that those in quarantines do not come out and increase the risk of infection to the public at large. And we also established additional check gates here in not cross unchecked, untested. Now also we are still guarding the border. Now also our state government has made it mandatory that those who are coming from outside the state are tested at the point of entry, so that they do not bring virus inside without testing. If they are tested positive, they are taken good care. They are taken to COVID care center or dedicated COVID hospital. And still we are working hard, and we ensure that our people do not get any problem. Still we are providing assistance to the public whenever they have. We have started 24/7 helpline numbers now in all police stations, so that they are available around the clock. Officers may change, but the number, mobile number, 24/7 helpline number, in addition to 112 now, and 100, dial 100, dial 112, we are maintaining 24/7 helpline numbers, which are having smartphones, smart facilities, so that people can send the videos, audios, and any kind of photos, so that police can attend it at the earliest. With this, I think I should conclude. And thanks to the East Coast team for inviting me and joining here. And also, best of luck to all the participant colleagues. Thank you, sir.
Thank you, Mr. Amu. Yeah. Can I ask you a few questions?
Yes, sir. Yes, sir. Most welcome, sir.
Yeah. How far is the lab where you used to get the tests done? Is it in Itanagar?
Now, no, earlier, sir, we used to send it to Dibrugarh and Guwahati. Now we have testing facilities at TRIMS. That is, we have our own medical college hospital, Tomoruba Institute of Medical Science and Hospital. We have here one. So we are testing it. Now we are doing all tests like rapid antigen test, and also RT-PCR and TrueNet. We are doing all tests now here.
Rapid antigen tests are used for a different requirement than RT-PCR tests?
Yes, sir. Yeah, rapid antigen tests are done so that we need results at once. Supposing we police officers, we cannot wait for a longer period to get our test results. So we first do it on rapid antigen test. In case of any positive result, we again get it confirmed from RT-PCR or TrueNet.
Rapid antigen is cheaper also.
Yes, it's cheaper. Here, state government has fixed at rupees 250 for the people here, and those coming from outside, it is 200 to 500. And for all the frontline workers like police and then doctors, nurses, they are free.
Okay. Thank you.
Sir, thank you, sir.
Yeah, I've asked my questions. Thank you.
Thank you, sir. Thank you,
Mr.
sir.
Sharma, would you like to ask?
Yes, sir.
Can you hear me, Mr. Sharma?
Yes, sir. I can hear you, sir.
Yes, sir. What is your experience of this Arogya Setu in contact tracing? That is point number one. Number two, if there have been more cases or less cases of infecting police personnel officials itself with COVID. So, what is your experience in your state?
Yes, sir. In month of July, around 37 of my police personnel were infected. Almost one whole police station, because here in Itanagar in Arunachal Pradesh, the number of police personnel per police station is very less. We are having just around 70 police personnel. Out of it, 30 were infected at police station Naharlagan. So we had to take care of them. And now in entire capital region, we are having around 800 police personnel here, but 55 of them were infected, including one of my SDFO. So, but then we have been educating our police personnel also to ensure that they put on mask every time, and they never touch their nose, ear, eyes, nose, and mouth without washing hands. And they are also asked to maintain social distancing. And we are also not conducting any crime meeting as it used to be. We used to conduct monthly crime meeting every month along with the officers. Now we are conducting crime meeting through Zoom and other Google apps. So and as far as RW Setu is concerned, it is very helpful. Because I personally downloaded it in the very initial days when during that I think Janta curfew time. Just after that,
Yes.
it was launched. So we myself started. It's very helpful, and also it shows us how risky you are. And with the help of Arogya Setu, one lady constable also got herself tested from my office, and fortunately or unfortunately, she also came out positive, and it gave us sufficient time to take care of ourselves to ensure that our office, SP office, was none of the personnel in the SP office was infected, because she tested on time because of Arogya Setu.
Thank you, please.
So thank you, Mr. Tume. Nice presentation. So moving on to the next, I'd like to call Dr. Aarti Singh to give the presentation. And the project is from Guntur Urban Police Department. From Nasik Rural Police Department for the project's response to COVID-19. You may proceed. Thank you.
Thank you so much. First of all, thank you for selecting my presentation. And here, respected jury members,